Okay. Which of the following is the most likely cause of this patient's bronchial changes? Aspiration, immune deficiency, inhaled irritant exposure, mucociliary clearance impairment, or pulmonary embolism? Um, a 30-year-old man with a history of cystic fibrosis presents to the clinic with worsening cough and increased sputum production. He's had multiple hospitalizations for respiratory infection in the past. On physical examination, there is clubbing of the fingers and coarse crack within the both lower lung fields. A chest CT reveals a bilateral bronchial dilation and thickening. Which of the following is the most likely cause when this patient's bronchial changes? When I think of cystic fibrosis, I think of like everything that can happen in the lungs, especially like with the like impaired chloride channels that don't allow sodium back out, or like sodium wants to follow it, and so does water. So you have really poor drainage of like you have really thick fluid mucus in the lungs. And so my thinking here is like mucociliary clearance impairment because it's so thick it doesn't like clear as easily.
Okay,
Um, so that's my initial thought. Aspiration, I don't think so. There's nothing here that makes me think that he aspirated something. He's not old. He's not in the hospital. He has nothing like that. So, uh,
good.
yeah, I don't think that immune deficiency. I mean, it is immune deficiency that can, like, that's. I feel like it's kind of like a cop out answer. Um,
Okay.
I don't think that's the best answer here. Inhaled irritant exposure. I mean, I feel like that's mostly like allergic, like EOE stuff. Maybe like you're a farmer with a bird, like
Okay.
stuff like that. I feel like that's maybe not the right answer. And then this is not a pulmonary embolism. So I would go with this.
Yeah, good. Great kind of way to clinically work through it, clinically reason through this. Definitely for sure, right? Because CF, like you said, one of the trick questions it does cause you immunodeficiency, but that's really not causing you your CF lung issues, right? Your CF
Yeah.
lung issues is because remember your CFTR gene, which is a sodium, right? Kind of sodium chloride channel, right? It doesn't work well. So what ends up happening is you have this thick mucus, and if you have this thick mucus, right, your cilia can't work as well, meaning that things get stuck there, and then you're going to have all this, CF lung kind of ordeal. So yeah, good. One of the key things people get stuck on is they're like CF equals immunodeficiency, but you're not answering the question, right?
Yeah.
Like you said, it's kind of a cop out answer. It's like, yes, that is factually true, but not the best answer for the lung issues.
Yeah.